So for today, we are going to talk about COVID-19 medications. I know that wala pang drug na approved as a treatment for COVID-19, but what I'm going to discuss are approved drugs by the FDA with their main use, but then they were found to have a benefit in treating COVID-19 as well. So tingnan natin if it's true or not. So before we start discussing about the medications, let me just give you a short discussion about the pathophysiology of COVID-19 para mas maintindihan natin discussion later. Okay? So paano ba ang nagmamanifest yung virus sa pasyente? Okay. First one, of course, transmission of virus through respiratory droplets and aerosols. So dati kasi 'di ba, nung kasagsagan ng ECQ, sabi droplets lang daw. But then na found out na it's also or it can also be transmitted through airborne, no? So kaya mas napapadali yung transmission ni virus from human to human. And then next, after that, after pumasok ng virus sa host, it will undergo endocytosis or membrane fusion with a specific protein called S protein or spike protein. So si spike protein kasi meron siyang two subunits and that's S1 and S2 protein. So these proteins, these spike proteins are responsible, no? Like si S1 protein, it is responsible for the binding of virus to the ACE2 receptors. And then si S2 protein, it is responsible for the membrane fusion. Okay? After that, no, si S protein, it will undergo activation via a two-step protease cleavage. So this two-step protease cleavage, magkakaroon ng opportunity si virus para mag-enter sa pulmonary alveolar epithelial cells. So, ang explanation dito is that kung mapapansin nyo, yung symptoms ng COVID-19 is usually pneumonia. Okay? This is because si virus, ang pinakauna niyang tina-target talaga is lungs. Okay? Yun ang main target ng virus lagi, yung lungs. And then after that, after entering pulmonary alveolar epithelial cells, si virus magre-release ng viral contents inside. And then it will undergo replication and formation of negative strand RNA. So these negative strand RNA will also produce positive strand RNA. And then these positive strands RNA will produce specific proteins such as viral N protein and viral M protein. And these proteins are responsible for the invasion of other parts ng body and for the transmission of the virus sa human. Okay? And then, 'di ba? Nagkaroon na ng invasion, nagmanifest na si virus sa loob ng body ni patient or loob ng host. Of course, ang gagawin ng body natin is it will respond to the virus. So, madedetect ng body natin na merong certain foreign body na nakakonquer sa body natin. So, that situation is called cytokine storm. So, this cytokine storm kasi, ang body natin magre-release yan ng iba't ibang inflammatory mediators like interleukin, MCP1, MIP1 alpha, or T cells, no, yung mga cytotoxic T cells natin, interferon alpha, interferon beta, and tumor necrosis factor. So these inflammatory mediators are responsible for the inflammation ng lungs natin. And then, kaya 'di ba, usually kapag lalo na kapag severe case of COVID-19, 'di ba? Usually ini-intubate na sila kasi sobra na yung inflammation ng lungs nila. Hindi na sila makahinga. So, this This one is the short pathophysiology for COVID-19. So the first drug that we are going to discuss is hydroxychloroquine with a popular brand name of Plaquenil and a dosage of 200 milligrams. So hydroxychloroquine is an approved drug by the FDA, and its main use is to treat rheumatoid arthritis and systemic lupus erythematosus. No, kung na tatandaan nyo si Selena Gomez. Okay? Hydroxychloroquine sa kasagsagan ng ECQ natin last year, no, naging trending siya as a treatment for COVID-19. So, ang mechanism of action niya includes the interference of endocytic pathway and blockade of sialic acid receptors, restriction of pH-mediated spike protein cleavage, or kung nakapag-bind na si virus and all, no, it can also prevent the situation called cytokine storm. So, 'di ba, kung iisipin natin okay siya kasi um mape-prevent dito yung pag-inflame ng lungs ni patient. So, ibig sabihin, may iwasan yung severe complications like intubate pa si patient. Yun yung nakakaawa kasi. So, yun. So, I found this journal about hydroxychloroquine. Its title is Hydroxychloroquine in COVID-19, Potential Mechanism of Action Against SARS-CoV-2. And dito ko actually nakuha yung mechanism of action ng hydroxychloroquine. And this drug only tells us, of course, the mechanism of action ni HCQ and its potential adverse effects niya sa mga patients na na-treat for COVID-19. So, dito sinabi kasi na nakitaan si hydroxychloroquine ng adverse effects nung binigay yung hydroxychloroquine as a treatment for COVID-19 nga. Like gastrointestinal complications, retinopathy, and QT interval prolongation. So, um, this journal tells us na it can be a treatment for COVID-19, pero yun nga, may adverse effect siya. So, di ba, in clinical practice, the benefits should outweigh the risk. And this journal also tells us na it is not 100% preferred drug or treatment for COVID-19. So, kailangan pa ng further studies for it. Okay? So, patient education for this drug includes it can increase the risk of QT prolongation in patients with renal insufficiency and or failure. So, for those patients na may arrhythmia or cardiovascular complications, no, they should tell their doctors na meron silang ganon para maiwasan yung mga future complications. Okay? This can also cause severe hypoglycemia. So, if si patient, no, mababa na yung sugar levels niya, and then nag-take pa siya ng HCQ, so, mas lalong bababa talaga yung sugar level niya. And this can cause major complications, symptoms sa patient. It can also cause hemolysis. So, from the word itself, hemo, RBC, and lysis, which is burst. So, death of RBCs in patients with G6PD or glucose 6-phosphate dehydrogenase deficiency. So, another factor yan. So, next one is it can interact with other medicines that cause QT prolongation even after discontinuing the medicines due to their long half-lives of approximately 30 to 60 days. So, magkakaroon ng additive additive effects. Kasi 'di ba, um, if yung certain drug na isasabay mo for HCQ, is magkakos din siya ng QT prolongation, and then si HCQ, di ba, can also um, increase the risk of QT prolongation, no? Kakaroon ng additive effect. So, mas malala siyang adverse effect. Next drug would be dexamethasone with a brand name of Desilone or Desilone Forte and a dosage of 0.5 milligrams to 10 milligrams daily. So, this drug is mainly used as an anti-inflam, no? Corticosteroid siya, and allergies, no? This is also used in treating allergies sa mga patients. Okay? So, this drug is found to treat in COVID-19, pero hindi niya directly kinikill yung virus. No? So, as a corticosteroid, it only treats yung cytokine storm. Meron siyang kinalaman doon. So, MOA, in treating COVID-19, there are two types, genomic mechanism and non-genomic mechanism. So from the word itself, genomic, it involves genes. Nag-occur siya sa genes. Non-genomic, hindi. Okay? We'll discuss it one by one. For genomic mechanism, si drug, no, nagbabind siya sa cell membrane, and yung formation niya nagli-leads to translocation of the corticosteroid sa cell where it travels sa nucleus. And then after that, it reversibly binds to several specific DNA sites resulting in transactivation and suppression of a large variety of gene transcription. Kaya siya nagiging genomic mechanism. So, ang kinagandahan dito is it can inhibit 5 pro-inflammatory cytokines, which is yung interleukin, one is interleukin, TNF, or tumor necrosis factor, IFN, gamma, VEGF, and prostaglandins. So these 5 pro-inflammatory mediators kasi are involved in severe cases of COVID-19, no? So maganda siya, 'di ba? So kapag na-inhibit 'to, 'di ba? Masusuppress yung inflammation sa lungs ni patient. At the same time, no, it can also induce the synthesis of interleukin-10 and lipocortin-1. Okay? Next one is non-genomic mechanism. So, si non-genomic mechanism, ang focus niya is sa T cells. No? Kasi lagi-lagi yan eh. Laging na-involve si T cells kapag merong certain na foreign body na naka-invade ng body natin. So, si dexamethasone with high doses, it binds to membrane-associated GR on cells, such as lymphocytes, resulting to the impairment of T lymphocyte. Okay? And then after that, si drug, it will bind to integrins, leading to the activation of PAC or focal adhesion kinase. And then, as well as that, a high dose of dexamethasone also interacts with the movement of calcium and sodium across the cell membrane, resulting in a rapid decrease in inflammation. So, ganda niya, di ba? Kasi ang daming inflammatory mediators yung nasusuppress niya at saka nai-inhibit. Yun. So, journal for this drug, dexamethasone for the treatment of coronavirus disease, a review. So, this journal is about, of course, dito ko din nakuha yung mechanism of action ni dexamethasone. It only discussed about its use, no? And um, sinasabi kasi dito na ang effect ni dexamethasone is for severe cases lang. Wala pa siyang, ayan o, severe COVID cases lang. Wala pa siyang effect sa mga mild form cases of COVID-19. Okay? So, patient education for this drug, no? Nung kasing nalaman na si dexamethasone is used, ginagamit siya as a treatment for COVID-19. So, ang daming nag-hoard ng dexamethasone. So, akala nila kasi antiviral siya, na nakikill niya yung virus and all. So, alam mo naman, di ba, kapag sa botika, malalaman mo, daming nagtatanong noon ng dexamethasone. So, as a pharmacist, I educate my patient na this is not a treatment for COVID-19. So, this is a this is only used for inflammation, no? So, patient education, of course, do not self-medicate kasi kung wari wala ka namang COVID-19, then gumamit ka ng dexamethasone. So, for example, for 2 months or ganyan. Akala mo kasi, di ba, nakaka-treat siya. So, yung long-term use niya kasi, di ba, is pangit sa katawan ng tao. And this is not a prophylaxis for COVID-19. Kasi akala nila, pag nag-take ka nito, di ka makakakuha ng or di mo mamamanifest yung COVID-19. So, it is not a prophylaxis. So, ang prophylaxis dapat is yung mga vaccines. Pero kasi nung time na yon, wala pang approved vaccines for COVID-19 eh. So, this is only used for patients who already has severe COVID-19. So, for mild cases, wala siyang effect. No? No effect. Okay? Next drug will be azithromycin with a brand name of Zithromax, 500 milligrams to 1 gram daily. So, this drug is mainly used to prevent certain type of infections. So, it works by suppressing the bacterial growth, no? So, under siya ng macrolide antibiotic. So, mainly sa bacteria siya nag-work. So, yung mechanism of action niya in treating COVID-19, to shorten the discussion, no? Yung direct effect niya is sa viral spike protein and ACE2 inhibitors. So, pinaprevent niya yung pag-bind ni spike protein sa ACE2 receptors. Azithromycin also interfere due to its affinity with the binding interaction point of the spike protein and ACE2 inhibitors. And then it also has an indirect antiviral effects by inducing the intracellular mRNA expression of antiviral genes, no, interferons stimulated genes and interferon production in infected host cells. So, si interferon kasi is a cytokine and it works by modulating yung immune response ng body natin. So, nakaka-help siya as an antiviral effect sa virus. This is what I found, no? So, azithromycin in COVID-19 patients, pharmacological mechanism, clinical evidence, and prescribing guidelines. This journal tells us that sa global COVID-19 pandemic, no, ginamit yung azithromycin plus yung hydroxychloroquine. Yan, no? Azithromycin and hydroxychloroquine as a treatment um, for COVID-19. This drug is only used as a treatment for empirical treatment ng CAP or community acquired pneumonia. Di ba nga kasi, ang COVID-19, nagkakaroon siya ng complications like pneumonia. So, azithromycin, yun, pinaprevent niya yung, so treatment siya for CAP. Sinabi din na hydroxychloroquine, di ba nga, di-discuss lang natin kanina, can cause QT prolongation as well as azithromycin. So, may serious adverse effect din si azithromycin that it can also cause prolongation of QT intervals. So, another factor yan na dapat nating um, i-discuss kay patient, lalo na kapag may cardiovascular complication siya. Sinabi ng World Health Organization na hindi si azithromycin ang main recommendation as a treatment for COVID-19. Pero, some of the countries, ginagamit ang azithromycin as a first-line treatment. Ayan. For COVID-19. Pero yun nga, several scientific societies including ACC or American College of Cardiology na yun nga, yung lack of evidence ni azithromycin as a treatment for COVID-19. So, patient education may cause an abnormal heart rhythm. So, again, sa mga patients na may cardiovascular complications, no, mabuti pang iwasan na lang yung pag-take nito. Antibiotic-associated diarrhea. So, azithromycin can also cause severe diarrhea. Okay, so, pangit din to kasi, syempre kapag nagkaroon ng severe diarrhea si patient, manghihina siya lalo. Liver problems warning. So, ayun, lalo na sa mga pasyenteng may mga liver disease like cirrhosis, jaundice, hyperbilirubinemia, mga ganon. So, kailangan na lang ng dito, warning kay patient. Myasthenia gravis, antibiotic resistance, of course. Lagi naman to na warning lalo na kapag sa mga antibiotics. And then drug interactions with nelfinavir and warfarin. Kasi kapag tinake mo si azithromycin with nelfinavir, magkakaroon din also ng liver problems and hearing problems. And for warfarin naman, kapag tinake mo siya with azithromycin, magkakaroon ng increased risk for bleeding. Why? Kasi, or how? Kasi, di ba, si azithromycin, it kills bacteria. So, kapag tinake mo si azithromycin, and then, na-kill yung bacteria or yung normal flora natin sa large intestine natin, which are responsible for the production of vitamin K, which is yung vitamin K, di ba? Pro-coagulation sila. And then, nawala yon yung normal flora. So, wala ding magpuproduce ng vitamin K. So, si warfarin, pag tinake din siya, lalong magkukos ng bleeding kasi walang vitamin K na nagmo-modulate ng effect ni warfarin. So, yun. Thank you for listening. God bless. Ingat!